When Akio Toyoda said, "We will be reforming our company to become a mobility company," what he really meant was, we will be working towards providing safe, clean, and convenient mobility options for everyone. When we say everyone, we must really think about two important segments: a group that does not drive and a group that does not own a vehicle. Typically, these segments are made up of the aged population and the disabled population. It's especially important for our company to take a look at these segments for two reasons. One, from the latest new vehicle customer study, we saw that the average age of a Toyota customer is 55 years old and the average age of a Lexus customer is 60 years old. Two, research also pointed us to how rapidly the US population was aging. By 2034, 20% of the US population will be above 65 years of age. Our group decided to look at this space to understand what services can we offer to our loyal customers who have leased or purchased 3, 4, 5 Toyotas and Lexuses in the past, but has no way for them to be associated with the brand when they have to retire their keys. Further research also showed that close to 3.6 million people miss medical appointments due to lack of access to dependable transportation. These missed appointments have a cascading effect on the whole ecosystem, leading to increase in the risk of hospitalization, further putting pressure on healthcare infrastructure such as emergency rooms, ambulances, and hospitals, and thus increasing the costs to agencies such as Medicare, Medicaid, and insurance plans. The agencies have realized that to bring the overall costs down, prevention is better than cure. Entities such as insurance plans, hospitals are trying innovative ways to prevent people from missing their medical appointments by earmarking transportation funds to get a person to the medical appointment. There is a whole industry known as non-emergency medical transportation, commonly known as NEMT, which promises to provide a ride by claiming this earmarked money. But the problem is, the whole non-emergency medical transportation industry is highly fragmented and localized. Between the entity that pays for these trips and the entity that services the trips and the patient who receives the trip, there are many touch points, making the transaction complex and inefficient. We felt Toyota has an opportunity to come in and create a vertically integrated ecosystem and remove some of the inefficiencies by using our customer-first approach, our process-driven approach, our global brand value, and our quality of vehicles. Now, to set up a NEMT ecosystem, 5 key elements had to come together. Access to paid trip sources, access to a driver ecosystem, access to technology platform to dispatch rides, maintain vehicle, driver, and customer information, access to a fleet of well-maintained vehicles, and access to call centers and operations management team to manage the day-to-day activities. Out of all these capabilities required, Toyota just had access to used vehicles. So we partnered with Phoenix Mobility, a non-profit group dedicated to supporting mobility for vulnerable and underserved populations, to develop these capabilities. We launched a pilot program in April 2020 in Corpus Christi, Texas, to set up a service which can take people to their medical appointments. We established an office space in Corpus Christi, hired an operations manager, worked with our auctions and local dealership to create a fleet of 4 used Toyota vehicles, and even hired paid drivers. We also established a live call center in Nebraska and have developed a technology platform which has a combination of a passenger app, a driver app, a hospital portal through which business to business customers can request rides on behalf of individuals. Though NEMT is originally meant to take people to their medical appointments, when COVID hit hard, we saw that transportation issue was not only for someone to get to their medical appointments, but also for basic determinants of health like access to groceries, fresh food, place of employment, and medicines. So we were able to pivot with the help of Phoenix to see how we can use the same capabilities that we had developed to service these varied needs of the community as well. So in the last 8 months, we have completed 264 pharmacy deliveries, 200 passenger rides, 115 food deliveries with an average fleet utilization of 22%. Now, as we continue our efforts on this pilot, we're constantly working with agencies such as hospitals, NEMT brokers, insurance plans, and even marketing to private pay customers to find sustainable paid trip sources and seeing if there is a path to profitability while being able to do social good. Thank you.